Okay. Okay. Now we have attendees showing up. Good morning, everybody, and welcome wherever you may be joining us from. We're going to be getting started in just a few minutes. We'll let people stream in, so we'll probably aim to start around 5 past. Thank you. Um, Hello, everybody. Thank you for joining us today. I think we'll get started. Apologies for the delay and any last technical issues. So welcome. My name is Lynn Yoshikawa. I'm the regional representative for CaLP based in Washington, D.C., usually, actually. Today, working out of Maine, which is quite lovely, too. We're pleased to have all of you join from all parts of the world, and especially our speakers today. Before I introduce them, I wanted to kind of go over the background why we wanted to host this learning event among the very many webinars that are happening today. But we're all aware that with the COVID-19 crisis, there's been a very high demand increasing needs and increasing operational challenges to respond to those needs. And the one area that we've identified as a bit of a gap, and where we've heard a lot of questions from across the CaLP network and other stakeholders, is on how to address these things. So we wanted to organize this webinar today to share and discuss some of the risks, challenges, and solutions that various agencies have come up with. We also wanted to use systems thinking, which we'd applied in CaLP's Future of Financial Assistance report, to look at how we can address some of these unprecedented challenges. And lastly, we wanted to deepen the collaboration and partnership with private sector actors as well, so that we could see how we can find solutions together. So today we will have speakers talking about experiences from across the globe, including Somaliland, the DRC, Colombia, and Jordan. So we are, I'll go into a bit more depth on the agenda now. Next slide, please. Just some housekeeping issues. So the webinar will be 90 minutes. About the first hour will be presentations from the various speakers, and then the half hour will be for Q&A. You'll note that your mics are muted. For Q&A, please use the Q&A chat box. There's a bar along the bottom of the Zoom window where you can enter in your questions. So please enter all Q&A there. You can use some chat for to share your experiences, etc., from your organization as well. This will be recorded, and the PowerPoints will also be shared later this week. So don't worry if you have to jump off. We know things are quite hectic, but we'll be sharing those to all who participated and through CaLP's regular communication channels. So with that, if we could go to the next slide. We're very pleased to have an excellent group of speakers with you today. Jaki Mebur is the Marketing and Engagement Manager for GSMA's Mobile for Humanitarian Innovations. She'll provide some brief opening remarks looking at the MNO expansions in the MNO context. Next, we have Ali Omar Bosir from Telesom, Somaliland, who will talk a bit more about adaptations that they've made from an MNO, a very specific context. Next, we will have Han Cheng Cha, who's joining us from Give Directly as Director of Special Projects, and he'll be providing some examples of Give Directly's recent pilots in East Africa. We'll next turn to Simon Reed, who's the Deputy Director of IrisGuard, who will also share some adaptations to their biometric technology and discuss some of the importance of partnerships with humanitarian agencies. Last but not least, we have Rosa Akbari, who is the Senior Advisor for Technology for Development for Mercy Corps. And she'll be speaking a bit more about the ethical and inclusion challenges and solutions that they've come up with at Mercy Corps. And then we also have with us Anna Kondakshian, my CaLP colleague and program coordinator, who will be managing the Q&A and closing remarks as well. So without further ado, if we could turn to, we'll stay here, we'll turn to Jaki to provide opening remarks. Jaki, over to you.
Thank you very much, Lynn. Hello, everybody, and thank you for the opportunity to speak here today. As Lynn has said, my name is Jaki Mebur, and I'm with the GSMA, which is a trade association for mobile operators, and specifically with the Mobile for Humanitarian Innovation program, which specifically looks at opportunity to digitize humanitarian assistance, and digitize in the broadest sense, which also includes mobile. So my session today is specifically to look at, a general overview of, the global trends, how mobile operators responding to this particular COVID-19 pandemic, and then what opportunities have arisen from this. So yes, number one, there is definitely an increased demand for mobile services across the board, looking at, data to the homes, more, voice calls, SMS services, and quite specifically looking at mobile money. And I will focus mostly on the global south, where there's been a noted increase in mobile money as a delivery mechanism, specifically for humanitarian and then social protection assistance. This increase in interest has resulted in the mobile operators looking to further their investments in strengthening coverage. And by coverage, I mean both connectivity and in the agent network. Some examples from around the world of how operators are adapting to this would be, first of all, in fee waivers. There have been lots of fee waivers driven by both the regulators, so government mandated fee waivers, and also by the operators themselves to, number one, promote cashless transactions, and number two, to increase the cashless payments for services. This is in countries like Myanmar, Nepal, Ghana, Nigeria, Liberia, and Kenya. An example from we have Money in Myanmar, for example, partnered with their government to facilitate waiving service fees for any transfer of COVID-19 affected any funds to COVID-19 affected businesses. So this was a social safety net, but specifically looking at businesses. There's also an interesting trend in using mobile operator infrastructure to support non-mobile operator service. For example, Safaricom in Kenya used their agent network, their mobile money agent network, to distribute personal protective equipment. Zain Cash in Iraq had their, their staff registered as essential workers in order to enable the delivery of cash assistance. From the government side, a lot of regulatory support has changed and to support, pandemic response. Good example is from the United Arab Emirates, where the Telecommunications Authority essentially put on hold suspensions and disconnections of mobile services to ensure connectivity through this pandemic. In Uganda, the Uganda Communications Commission fast-tracked decision-making, especially when it came to COVID-related, telecommunications interventions. Then, of course, the operators, mobile operators, are looking beyond just cash payments. The operators have been actively involved in helping people manage challenges created, very specific, pandemic-related challenges. For example, using the mobile network information to disseminate information, using the mobile network call centers to support, hotlines for COVID-19, sending informational messages, and this is an interesting one. For calls, instead of a general ringtone, you hear a health message on COVID-19. They are introducing packages to handle e-education, home working, activating their business continuity plans to increase capacity on the network, supporting fundraising, movement of money essentially, so fundraising initiatives, reduction in fees, cash donations. And then what we're talking about today, the opportunities that lie in remote registration and verification using digital tools that make it efficient to select, enroll beneficiaries, supporting and targeting, and finally transparent delivery of support. And I'm glad you have Telesom and IrisCard here today, and they will elaborate further. So in conclusion, my advice to this webinar right now is, as the decisions are made in the delivery of cash and the infrastructure around it, looking at registration, looking at verification, it is important to consider long-term and sustainable solutions, and then look to get a supportive regulatory environment in partnership with mobile operators or private sector providers of these services, and finally make considerations on necessary digital protection. I have shared GSMA material on COVID-19 response. It's quite a lot, and I'm sure CaLP will share this after the webinar. All in all, I am open to questions, and thank you very much for this opportunity. Over to you, Lynn.
Wonderful. Thank you so much, Jaki. It was a great whistle-stop tour of a lot of issues, and I think you've really highlighted well how interconnected the responses are with government regulations, social protection systems, looking at messaging, and I think other speakers will also touch on these experiences too. So now we'll turn over to Ali Bosir from Telesom. Thanks, Ali. Ali, you are on mute, I think.
Thank you, Lynn, and good morning, Good afternoon and good evening, everyone, wherever you are. My name is Ali Bosir. I'm Head of Business Development at Teleson. We work with the private sector, public sector, and the NGOs. My presentation today will be mainly focused on our work in the NGO domain. Next. I'll give you a quick introduction about Teleson. So Teleson is a leading mobile operator company in Hargeisa, Somaliland. That was established in 2001 and soon became a group of companies. Next. And we work in 4 different sectors. Our group of companies operate in different sectors. So the energy sector, we provide electricity, green energy, and LPG gas. And the finance sector, we do provide banking services, and we give a special consideration to financial inclusion so that we make sure everyone has access to financial services. In the construction sector, we have been introduced to modern technology whereby we want to transform the way construction is done in the country by providing high quality standardized construction materials. And also we have several companies in the service sector that is going to transform the sector with the new technology. Next. So coming to the humanitarian projects, which is our topic today, Telesom is always has a big role in the humanitarian projects in the country, whether that is corporate social responsibility project or working with the NGOs. So today I'll be talking about the COVID-19 pandemic, and also I will conclude my presentation by talking about how we've come over the challenge of registration, verification, in remote areas for cash and voucher assistance projects. Next. During the pandemic time, we've done 2 projects. So I'm just listing the 2 major ones, but there were a lot of projects that we've worked with. The number one is the awareness campaign that we have worked with the Minister of Health so that we can deliver a recorded voice message as a ringtone to everyone. So everyone who calls another person will hear the voice message. That is all about to know about the COVID-19 and give you instruction on how to protect yourself and the families. And this has shown very high success rate, so that everyone who uses mobile phone today in the country, especially in the remote areas, are aware about the COVID-19 and knows about the basic protections that they need to do. In the education sector, that was a sector that was completely shut down during the COVID-19, and we had to introduce a quick solutions for the sector because it was interrupted during the academic year. So what we have done is introducing a conferencing solutions, whether that's a call conferencing, video conferencing, and especially we are targeting the remote areas where people have no access to internet and other technologies. So students can be able to listen lessons or also get access to previous lessons by using an IVR. In some situations, video conferencing was a good solution, and that was also provided to education sector. And especially schools and universities, we have given them a new e-learning platform that's called Coursera during the pandemic time. All these projects were free of charge from the company as a corporate social responsibility. And also there were many other activities done by the company for the COVID-19 project. Next. Coming to the cash and voucher assistance projects, we've worked with the cash and voucher assistance projects a long time with the NGOs and came with the challenge they have in the registration, verification, the remote areas. And the biggest challenge at the time was carrying actual cash to long distance remote areas and giving those cash to beneficiaries. So what we have responded with that is the mobile financial service, so that beneficiaries can receive cash as a mobile transaction in the remote areas and in these places. So this was a very useful for the NGOs, and it has responded to the challenge of carrying cash for a long distance. And now almost every NGO that works with the cash and voucher assistance projects are now using our mobile money platform. Next. So the mobile money platform was only responding to the challenge of carrying an actual cash, but that was not enough. So we had to take to the next level and introduce a new advanced technology by using a voice identification system. So with the voice identification system, we can combine our mobile money, voice ID system, and the telecom services. And with that, we were able to successfully implement the voice ID project with the CARE International NGO. And thanks to CARE International, they allowed us to work with them as a pilot project with their cash assistance project. And we started this pilot project at the beginning of the year. And now we are running for the second cycle. And we have completed both registration and verification in the remote areas by using the voice ID system. Next. So how does the voice ID help the cash and voucher assistance project? The cash and voucher assistance is mainly a registration and verification process. So during the registration, so far NGOs have been using the most important thing to capture from the beneficiary is the biometric information. So the NGOs have been using the fingerprint, which was really a challenging to use a fingerprint. You always have to carry with you fingerprint equipment, and most of the time it might fail when you are in the remote area because of dust or other challenge. So that was not enough as a biometric information capturing system. So what we have introduced is a voice identification system that only you need to use a basic phone. And basic phone is something that every beneficiary has at the moment. So with the basic phone, beneficiaries are able to use the voice identification system. And the other thing we introduced is also whitelisting in real time during the registration process. So this means during the beneficiary selection process, when the staff are in the field doing the selection and registering the beneficiaries, we can at the same time register those beneficiaries in real time with the voice identification system, so that we don't need to do the data compilation and put in and bring all the data together. And in the emergency cases, NGOs can immediately send cash out if needed, because the beneficiaries are already whitelisted in the voice identification system. And after that, once the beneficiaries are whitelisted, they can use their basic phone by calling in the voice ID system and saying the passphrase, and that will be captured and used for the next process of the verification. Next. So in the verification process, and what we do now is that at the time of payment, when the payment time has reached, so we send an automated voice notification, and that voice notification carries two information. One is to inform the beneficiary that now is the time to claim your cash, and the other part is to give them instruction on how to claim the cash. So by using their basic phone, they will dial in the system and go through the process and say their passphrase, and our artificial intelligence system will capture the voice and then verify the person. If the person is verified successfully, then a mobile money is sent to the beneficiary, and all this thing can happen within a minute, and the money is paid to the beneficiary. Next. So the benefits of the voice ID for cash assistance projects are really many. So I'm just putting a few here. The only equipment that's needed is the basic phone, which is something that's available to every beneficiary now. And also registration can happen in real time, and at the same time, beneficiaries can claim cash if needed. And the other thing is also, if cash is not used, it remains in the NGO's account. So the way it was before, NGO used to allocate a certain amount of cash, and at the time of payment, we used to send all this cash to every beneficiary, whether that beneficiary is available or not. And we have no information about how that cash is being used. So during our pilot project, we have seen several cases that cash was not claimed. And when we try to find out the reason, some of the reasons were beneficiary passed away, or moving from region to region, and many other cases. So this cash that are not claimed is going back to the NGO's account, and we provide a full report for the verification process back to the NGOs, so that they know how cash was expended, and who has claimed and who did not claim the cash. And the other part is also monitoring and evaluation. So that can be also done remotely, and this is also an effort for the NGOs really to go back to the remote fields, and then they do the remote and monitoring evaluation by identifying the beneficiary with the fingerprint and then making sure that they have received the correct amount. But all that can be done remotely by using the voice identification system, identifying the person that they have received the amount, and also comparing with the report that came out of the verification process. So these are the basic benefits that we have seen during the pilot project. And the pilot project has really showed a good success rate of the usage. And the other challenge was that at the beginning, we were a little bit worried about how people can adopt this technology by using their voice. And this was something very quite new to them. And also recording your voice was given some sort of a worry for the beneficiaries, that what you are going to do with our voice and this sort of things. But we came across all those challenges, and the beneficiaries have quickly adapted and using easily now the voice verification, especially the second round. And we have seen an almost 90% of cash claim without any assistance from the NGOs or our staff on the ground. So everything was done by themselves, by calling the system and claiming the cash with the verification system. So now our next step is really to scale up the system and make sure that other NGOs can also benefit from our service in this area. Any questions, I will be ready for that, and thank you very much.
Thank you so much, Ali. We actually had a lot of questions about the voice ID technology. So maybe most questions we'll try to tackle at the end, but maybe if you could take a couple minutes to talk a bit more about the technology and how it uniquely verifies the beneficiary. I think that's where most of the questions are focused on.
Okay, so this is another new technology. It has been used in many different places, especially in the finance sector, whereby the banks are using to verify bank account owner for any financial transaction. So we are using the similar system with a high rate of security, and we are using a one passphrase for all beneficiaries. So beneficiaries will not have different passphrases. They will only use one common thing so that it's easy for them to remember in the future. And we can identify with different voice synthesis of the different beneficiaries. In that way, we can identify the beneficiaries combined with their mobile number, because we have, on the other hand, a mobile platform where beneficiaries are already registered with the KYC process. So we combine the mobile ID with the voice verification. Together, we can also decide many things. And we can also, based on the level of the project and the requirements, we can provide a different level of authentication for the project.
Okay, excellent. I still see other questions, so maybe we'll tackle that in the Q&A session. Thank you very much, Ali. Now we'll turn it over to Han-Cheng Chow, who will talk to us more about Give Directly's experiences. Over to you, Hans.
Hi, thanks so much, Lynn. Before jumping in, let me just give some quick context about Give Directly, the organization I work for. Next slide, please. So Give Directly, for those of us who are familiar with the organization, we're a company that focuses exclusively on cash transfers. Historically, we've been working in the international development space, so cash transfers for poverty alleviation, but most recently have also been working in crisis settings, responding to humanitarian disasters. And to date, we've pushed out more than $250 million, predominantly across sub-Saharan Africa, but also most recently, we ran a big $100 million program in the US, and then have been working in the Caribbean as well. Next slide, please. So just to frame our discussion today, I'm sure many of us are facing kind of three main problems, right? We're recognizing that with COVID-19, more people are in need. Some estimates are putting it at about 18 million people or more who will be plunged into extreme poverty as a result of COVID-19. And so the big question that's facing all of us, whether we're humanitarian actors, development actors, or folks in social protection and government, is how do we grow our beneficiary lists? And the second problem we're facing is how do we grow these lists, especially in a time when we can't go door to door, right? Either for safety or because it's just too slow, right? We have 18 million people now who are more vulnerable than before the crisis. And then finally, as we design our models to scale beneficiary lists faster, what are some of the trade-offs and risks that we're taking on? Next slide, please. And so one of the things that we've been thinking about for a long time is how do we go fully digital and contactless? And we were thinking about this even before COVID, actually coming out of Cyclone Idai and going, you know, there's a really large geography here. It's just really challenging to deploy staff on the ground to go door to door. And if you think about, you know, for those in the cash delivery space, our work in 3 broad phases, right? Identify the people you want to pay, then you got to enroll them, and then finally you got to pay them, right? And historically, these 3 phases have been manual, and then maybe payment at best is digital through mobile money, right? But the identification and the enrollment piece has always been door to door with enumerators with surveys and smartphones. So the 3 steps: identify, enroll, and pay. How do we go digital, right? So not just in the mobile payments piece, but in the first 2 steps as well. Next slide. So, you know, this digital transformation, I think, is something that's happening across the world. And we're quite excited to be working with the Togolese government shortly. But before we came along, they had already done this incredibly exciting project where in several weeks, they enrolled more than half a million people in their country, completely contactlessly. And the way they did this was they said, hey, we have these 2 regions that are suffering significantly from lockdown. They stood up a USSD system. So for those of us who have lived or worked in emerging economies, you know that the way you top up your phone or you buy data, you add minutes, is to dial a USSD number. So on your phone, you dial *855#, you get taken to a menu, and then a survey can get served to you over this USSD system, and you need very low network to be able to execute the survey. And you just, you know, you say reply 1 for yes, reply 2 for no, enter your ID number, enter your full name, etc. So that's how they did enrollment. And then on the back end, once they got this remote enrollment, they would then screen it against several different databases where they you know, use proxies for vulnerability. For example, they said there are people in the informal sector who hold XYZ occupations. These are the people we want to pay. And then finally, they paid out using mobile money. So I think it's a very exciting example there. Esther Duflo, a Nobel Prize-winning economist, recently published a great video on it, and there's a great podcast which I encourage us to listen as well from the UNGP on this program. Next slide. So Give Directly is also deploying several similar approaches in 3 countries. We're working with the mobile network operators to blast out messages to certain target demographics in key geographies. And it says, please dial in to this USSD. You get served a survey. You then get an SMS from us to confirm your identity, confirm certain key messages on safety, recipient protection, etc. And then finally, you get paid out through mobile money or other digital methods such as cash pickup. And so what I've walked you through right now is kind of the enrollment flow, right? So how do you outreach? How do you sensitize? How do you get inbound and data collection, contact listing, and finally, how do you pay? But then the key question facing us, right, is how do you actually screen? How do you determine eligibility? Next slide. And the answer here is that we're exploring a variety of different targeting methods. But I will group them, I guess, into 2 different buckets. And the first is to screen against a data set, a very large data set of known attributes. And when I say known attributes, I would say, you know, these are things like gender, occupation, age, potentially existing social safety net databases, You know, in Rwanda, they have a great, you know, the Ubadehe poverty classification is quite comprehensive. They have similar ones in Jordan and in multiple other countries as well. But then the second is to derive a new data set of predicted attributes, right? And this is where it gets a little bit more tricky, but also very interesting. You know, as practitioners in development or humanitarian space, we're very familiar with VNAs, right? Vulnerability needs assessments, where, you know, maybe it's a 30 question survey, you go door to door. And what you're trying to do is predict somebody's underlying state, right? So a particular standard of living, whether it's poverty or whether it's some other form of vulnerability. The question now is, can you also predict these states through a host of different data sets? And let me touch on this in the next slide. Next slide, please. So it turns out that cell phone data, right, which is incredibly ubiquitous, you know, oftentimes larger and more live than government census databases or voter registries or social protection databases, is actually potentially quite predictive of poverty or certain kinds of vulnerabilities. And there's a professor in Berkeley, Josh Blumenstock, who are working quite closely with on this, who's written quite extensively since 2015 on this topic. And how you use your phone, right, can actually be very predictive of poverty levels. So you can imagine somebody who tops up several dollars of airtime on their phone every week, reliably does so. What does that reveal? It potentially reveals cash flow, right? Cash flow is highly correlated with wealth or poverty. Somebody who is making calls out of many different cell towers, what is that reflective of? That's reflective of mobility. Mobility, again, one of the indicators are related with poverty. And so what you can do is you can take the cell phone metadata and you compare it and find correlations against poverty surveys that we conduct, and try and identify which of these attributes is predictive of somebody's underlying state, whether that is poverty, consumption poverty, asset poverty, or some other form of vulnerability. And we found in some of our early work is that there are about 100 indicators that when you put them together can be quite predictive. Next slide, please. So why does this matter, right? Why is this potentially exciting? And there's a quote here by Josh in his 2015 paper that in resource-constrained environments, where census and door-to-door surveys are just really rare and really hard to do, this can provide timely information for a fraction of the cost of traditional methods. So just, you know, thinking about this, the full potential of this is that you could potentially, and I say potentially, calculate an entire next generation of safety nets, right? Based off this method at scale. Now, next slide, please. Now, let me just quickly touch on, and this is my last two slides, here, some of the considerations that we're taking into account as much as we talk about the potential. As with all forms of targeting and prediction, we want to be very careful about two types of error. One is that all forms of prediction can be wrong. You can falsely include somebody who is poor, who is wealthy, but you've classified them as poor. Or you could falsely leave out somebody who is actually poor, but you have classified as wealthy. And not to mention those who don't have phones are not considered at all. And so two quick takeaways here is that what we're trying to do is quantify the inclusion and exclusion error and understand the trade-offs vis-a-vis in-person methods. And we're also supplementing this approach with other methods, including working with community-based organizations to make sure that many vulnerable communities are not left out. And on my last slide, please. So what we're trying to do here is at the end of the year, have a bunch of different methods that we put some bounds on, that we say we're evaluating it across a bunch of different criteria, right? So we're not trying to say always use end-to-end digital methods. It's certainly not silver bullet. We are trying to say under certain conditions, under XYZ scenarios, when you're trying to solve for certain things, for speed, when inclusion error, exclusion error is at a certain threshold, or for particular costs, this is when you should use each method. This is one tool in a toolkit which we're trying to build and offer not just to international humanitarian organizations, but to social protection as well as government programs. And I think we're very excited to be able to share more come the end of the year. Thanks so much.
Excellent. Thanks so much, Hans. It was really interesting. I think there's going to be a lot of learning coming out of this, and it'd be great to see some of the indicators too that Give Directly has been looking at, and because I think various organizations are looking at them as well. Maybe not as systematically though. So thank you. Now we'll turn over to Simon Reid, Deputy Director for IrisGuard. Simon, over to you. Simon, you're on mute.
Yeah, that's it. Great. Thank you very much indeed. It's always good to come slightly down the line because you can hopefully pick up some of the points that have been made as well. So, and anyway, thank you for inviting us, new members to CaLP. So we look forward to this. Yeah, next slide, please. For those who don't know IrisGuard, we've been around since about 2001, and a lot of experience in iris systems, and it is basically we can find one person in millions anywhere in the world with 100% certainty, and that's an extremely important part. And I guess the point I wanted to make from this thing is that we're dealing with a system as well that ever since we started nearly 20 years ago, and you can put up the next slide, please. And click again. Thank you. Great. We started in border control systems, and our first real involvement with, in terms of the use of the iris, has been through several stepped phases. And 2013, we were involved with the UNHCR, and we now have the register of over 5.5 million refugees that are registered utilizing just the iris. And the point I wanted to make is that this is, from our point of view, all about the system. It isn't necessarily about the actual technology. It's about the management of data flow through the systems, which actually Hans was picking up on as well, as how do you have a flow through the system, utilizing a variety of different touch out points. And from last year, we also introduced the mobile phone, which is a very specific iris phone. It has cameras patented by ourselves on both the front and back. And that allows field workers to effectively produce a complete end-to-end validity of the beneficiary. And that's all about our recognition. It is about 100% guarantee of the beneficiary to their entitlement, to prevent fraud, and to effectively give the maximum amount that we possibly can. Next slide, please. And again, I won't tick through that, but our work really since the last 7 or 8 years has been quite well recognized by the UNHCR. And of relevance to this talk today, and the whole point is also the crossover with the mobile world as well. And in Iraq, we have seen that the provisioning of our service so that beneficiaries could use cash out points that were both at mobile service providers, but then translate that into the field, allowed us to address a lot of the COVID issues as well. So if you go to the next slide, please. Great. So you can see we talked about on our setup for this that photographs speak 1,000 words, and as many people know, I can talk for a long while, but some of the pictures I think really show how it's actually appearing. And in this particular slide, you can see in Iraq, somebody is using our phone together with a little small portable printer just to verify somebody and actually pay them cash. And if you go to the next slide, please. Oh, one before, thank you. It's just a collage of actually what we've been doing. So you can see people with masks on. We implemented this very quickly once we knew that there were some issues here. And again, you're probably aware that some of the banks have been failing as well, particularly in Lebanon, for instance. So a lot of the traditional cash out points for refugees and beneficiaries were shut down. So very rapidly, we managed to turn the system around so that in fact, there was virtually no interruption to the service. So on the left, you can see there that a refugee is completely covered up, but they're still looking into the camera. They're being able to pay to receive their goods and services from the supermarket. On the right, we have Cairo Bank in Jordan, which set up a mobile van so that they could effectively look at the continue the process with no interruption to this. Again, we've got a lady looking at a supermarket linked to the point of sale. And I think very relevant to today, we have Zain Cash, again, who we have a partnership with, and they effectively take the beneficiary lists from the UNHCR and have been able to offer cash out facilities, not just in their lockdown shops, which were locked down, but also to send out a person into the field. And the thing is, there's a complete validity of everybody who is involved within the system. So there's no fraud, and actually they're literally carrying a bag of cash with them to verify who gets it, that they are the recipient, they are the person authorized to hand out that cash, and that the recipient is the correct one. Next slide, please. Next slide, please. Great. So for us, it's about providing multiple areas where, in fact, you can have beneficiaries not specifically tied to one particular point, so that there is choice. And I think that's a very important factor in the work that we've been doing. And I'd like to put that down on the table for comments later, is that we're seeing refugees and beneficiaries as being inclusive of the economy, trying to make them as inclusive and less, let's say, less segregated against and included as part of the population, particularly for refugees. So we have multiple touch points. The post office is mobile wallets, again with Mafafti in Jordan as well, and Zain Cash. And if you could just go to the next slide, please. And just to share some figures with you as well. So it is actually a relatively light touch approach, but we've got over 81,000 households, $20 million has been processed through the system with 70 locations, and the 10 field operations were an extension from those original Zain shops in Iraq as well. So next slide, please. So from our point of view, we see, you know, that there were big challenges in Iraq about the vulnerable populations there. How could we continue to provide the service during this time? And the ability to have this streamlined service that had already been from a well-proven registered base allowed us to continue the services in the field, and that's important from us. Next slide, please. Yeah, we can skip over that one, please. Next one. Okay, so the other aspect is being able to provide, not just as has been pointed out by, I think, by Hans, that we are getting into a situation where we're going to have a lot more people around the world who are going to require what is often being called G2C, government to citizen support, and that is absolutely going to exponentially increase. I totally agree with the comments of other speakers. So utilizing existing what we would call quasi-government organizations to equip them with a facility to be able to again offer this 100% validity of the person in front of them and extend that to more local cash out points is really important. And I think we're going to see that as being a factor as well, about locality and people not having to travel vast distances to actually receive their benefits. And again, for a reasonably large value with a number of households, it's a relatively small touch output for the equipment required. Next, please. Just to reiterate, one of the deployments we have is within Egypt as well, and that is with the Egypt Post. And again, that is to support refugees who have moved countries. So I think that's another important point to make about the support of refugees in particular who are moving from one country to another. And this is something we have quite a lot of experience with, which again, we hope to share with the wider population. Okay, next slide, please. Proof of life, a very important thing. And I think there are a variety of systems that are out there, and we've seen some demonstration of a lot of them. But a lot of fraud occurs in many countries where effectively people are receiving entitlements, but actually there is no proof of life. And the one system, one requirement, of course, particularly with an iris scan, is that the person is alive and that is physically present in front of you. And that does, in many instances, cut a lot of fraud. And in certain areas, with our work with the WFP, we've seen figures higher than between 20 and 30% of fraud actually happening in the system, based upon actually the fact that this is not the actual person who is presenting their entitlement. So I think that's one of the key points, and you can see the growth of this through the system. Okay, next slide. Okay, and just to reiterate, it is about proof of life. The systems that we developed over the last 20 years are absolutely at the top of the technical tree, but more importantly, they are designed with the system in the back to ensure 100% accuracy. And that is a statement that is quite crucial from our point of view in terms of making sure that really the person who's in front of you is entitled to their benefits, and that the cash that they're giving or the value of the goods and services is correctly for that person or that family. Okay, next slide, please. Thank you. I think all of us are familiar here with, and people listening in as well, about the vast number of people who are unbanked. And I just wanted to flag, as I spent 25 years in the GSM world, the fact that linkage with existing systems, and including the mobile wallet, is very important for providing a complete service within the CBA environment. And these are figures from about a year ago, but there's over 272 mobile wallets across the world, with about 2.4, with a transactional value of about 40 billion. So there's no denying that the use of the mobile within the system is an important point. And of course, again, few of us are familiar that Elon Musk is starting to install satellites. So I think within the next few years, we will be looking at a global situation where we have complete connectivity, even in some of the more difficult areas. So I think that's something that we need to bear in mind as a community, that there will be some amazing opportunities to take advantage of that type of connectivity in the coming years. Okay, next slide. And just to summarize that, we wanted to share from the private sector point of view that we absolutely want to cooperate and try and give as much information as we can to NGOs to share that experience. And we've processed over it's getting closer to $1.5 billion in value through the systems with 100% accuracy. And that's something that obviously we're very proud of. But more important thing is it is actually delivering to real people in crisis times, particularly at this present moment. Thank you very much.
Thanks, Simon.
I hope that's got it in time.
Yeah, great. I think also really helpful to bring up the challenges faced across many contexts, including in high income contexts as well, where there are serious challenges with managing fraud. And I do see quite a few questions coming to you in the Q&A too. Great. Well, last but not least, we have Rosa Akbari, who will talk us through some of Mercy Corps' experiences. And I think we'll just have a quick pause as we get a different slide up. But Rosa, please feel free to start.
Sure, thanks everybody. I thought before getting started, just to give you an understanding of Mercy Corps' cash portfolio. I'm sorry about that.
Sorry, just to interrupt you for a second, Rosa. That link that you sent me, I don't have access to for the slides.
My bad.
Thank you. Sorry about that, everyone. Okay, that is sent. Just to give a quick overview of our portfolio. In fiscal year 2019, we had 53% of our humanitarian aid was delivered as a cash-based response. We have 58 active programs in 19 countries based off of our most recent reporting. Basically half of our countries of operation do have some form of cash programming, with many countries having multiple programs within them. So that's where the 58 number comes from. And I thought, especially given the makeup of this panel, and please forgive me and apologies to my colleagues who may be on the call, I am a technology for development advisor. I'm not a MEL expert. I'm also not a cash program manager. I've just had a lot of exposure to these things from the lens of systems and sustainability of introducing systems, which often the requests are around our approaches to registration, data management, and then connecting that with our transfers. So hopefully I'll give you a bit of a perspective from the NGO side. So firstly, the questions that these have never changed, but when a team anytime is interested to either adjust something that they're already using, transfer maybe from paper to digital. These are just the really generic questions that we go through. To be honest, it's not always me. It may be even people who are not on the technology team, where we try to promote this kind of, well, what are you doing now first? What are you doing now? What are all your constraints? And the constraints, whether they're from a donor, from context, and also making sure that the teams validate what's actually happening in practice. We all have experience. We know even if it's on paper, we really need to appreciate that validation from a team as to what those process flows are. In doing that, who is actually doing each step of this process? Are we working through local partners or not? There's a few other questions that we ask at that point, but really, we are sometimes exchanging data at a few different points. It's not always Mercy Corps doing the programming. We're either working in partnership with other agencies through local partners, et cetera. So it is important to get very granular to that aspect. And then as many people have mentioned, what are the trade-offs? I think especially in the time of COVID, there are solutions in isolation that make sense, but there is, we are also talking about potentially working with a new technology partner, potentially thinking that being quicker is actually better. And we're actually introducing potentially more risks, protection risk, whatever it may be. And so really thinking along these lines of trade-offs, and we're not
solely guided by efficiency. It is guided by impact and quality programming. And so that's just an honest conversation that we host with our teams. You can go to the next slide. And just to give you some context, because I think this, at least for me, this is the first agency that I've worked for that has had minimum standards that are tracked on a quarterly basis. We've put into place over a year ago now cash minimum standards for all of our programs. They're not prescriptive, but they are standards that we track at an individual level. So up front, as COVID occurred, we had this wonderful data set and subsequently connections with the teams and their programs to appreciate where they are and where already maybe, you know, the documentation and things, we didn't have to bother them, and we could essentially do that homework up front. And again, be realistic about capacity, about the history of constraints, and go from there. This is, yeah, I as a technology advisor, I can't tell you how important these standards have been in terms of really grounding things to make sure that we are being ethical, we are thinking broadly beyond just introducing the tech, like introducing the tech to what end. And these standards really help keep that conversation objective. Go to the next slide. And one thing is, thankfully, as CaLP hosted a prep call, something that struck me is when we say verification, at least, I think for most NGOs, there is kind of dual definitions. One is data quality. It's making sure that regardless of how that data was collected and things that you are making sure that the people that you have selected indeed meet the criteria that you established up front. And then the other, which I think is what we're talking about more, I consider more operational. It is authentication. It's referring to this process of making sure that the data that was received when somebody comes back, that it's linked in a way that you can verify that it is the right person or household that's coming. In our experiences, though, you know, authentication assumes that the information when it was originally provided to you is honest. And so I think that gets into some interesting conversations around identification versus authentication, which I will leave to our colleagues who work in the biometric space to focus on. Next slide. So the top line observations, and if these slides are shared, that's a direct link to a document that's in the CaLP library, was again, how do we ensure evidence-based selection and targeting? How do we continue our existing commitments to our donors, to our communities, as related to evidence-based targeting, and not compromising that and kind of throwing all the principles out the window and say, well, it's difficult for us to actually reach households now, and therefore we're going to compromise. To the best of our ability, we try not to do that. But I think in terms of critical thinking, as more teams who perhaps have not been as dependent on remote management or hard to access areas, that it's important for everybody to be planning for the worst, even if they're not in lockdown now, or you know, the cases weren't as high before as related to COVID. It was a bit of a nudge, I think, from the advisory side within Mercy Corps to ensure the teams are thinking ahead and making sure that they're thinking through the scenarios of, well, what happens when we have to triangulate data from a few different sources? What do we need in order to be confident in information if we potentially have to start to work with new partners? I think one thing that came out is it's not really one or the other. Community-based mechanisms should always be balanced with your ability to do some direct observation, direct data collection. A lot of these principles are not new. And I think that's an important thing for us to be keeping in mind. Another is the difference between remote and socially distanced processes. When at least when we, in Mercy Corps, when you say remote, it does start to indicate more of working through local partners and purely remote management, which has its own structures and due diligence processes, where that may relate to a registration process or not. The reality, and I think what for our teams as well, to the extent that they've been able, they didn't actually transition to purely remote registration if they could avoid it. They put in kind of the phase steps of moving towards socially distanced processes using contactless methods, but for me, that doesn't really constitute what pure remote management is. So that was just a distinction I thought I'd raise. But as I said before, I think the biggest thing is there's so much of this that's still business as usual. Just because it's a COVID and a global pandemic, we don't throw out kind of our logic that we've learned from other experiences as related to tech use within CVA. We always still need to identify the need and pinpoint the issues and validate within process flows. And I think especially as we're all working remotely, that's been a big shift for me. I'm not able to go with a country program and do some of this. That I really have to keep myself even tempered to make sure that I'm not promoting solutions in isolation. And I think that's just a challenge that has always existed, I think, with tech and innovation within the humanitarian space, but even more so now, is something that I would encourage that we all keep in mind. Along those lines, responsible data management, and any internal guidelines, we have a few recommendations as related to biometric use and digital needs definitions. We look at them, we revise them, but again, we don't just put that aside. We try and synthesize all of that with the context that we have. So quickly, I'll go through the next slide, the last two slides, that from Colombia experience, and my colleagues from Colombia had a plethora of information and documentation to share with me on this, primarily because they very quickly had to, or not the only reason why, but I think one of the main reasons why was that they very quickly anticipated what was to come and had to start getting the approvals from our donor. And I think that actually forced a lot of critical thinking in lines of what is possible as dictated by donors, not just by logic that we're observing on ground. And because it is in this instance, it is a consortium, I think even more so, all agencies were much more committed to, we don't want to decrease the quality of our programming or limit the quality of our programming. We really just need to look at each little adjustment that we're making and consider these trade-offs. And I think the team did a wonderful job facilitating that amongst the partners, just to figure out what really does make sense. What they had before was clearly vetted and outlined governance models, which includes SOPs and data sharing agreements and data governance structures. I think that gives you a much better foundation to then think, what can we change? If they didn't have those things in place, I think it would have been much more difficult to come to consensus across the four or five partner agencies on what to do. So they've done that legwork because they had ongoing programming. They also had digital data management systems already in place. Nothing, it wasn't emerging tech. It's not anything that's super fancy or sophisticated, but it is something that they were already familiar with. They were also already familiar with the partner, the tech provider, and so they didn't necessarily introduce entirely new systems. They adapted within what they already had, and they had, as a result of where they were working, I think already had considered how to work in more remote regions with indigenous territories. So some of the considerations, I think, while maybe not as extreme as you have to account for with COVID, I think it wasn't entirely new territory for them. I think the things that were impressed upon me really for them was whatever changes that we're making, and this gets a bit more to the, I guess, ethics behind it, are they clearly communicated to both the communities as well as the donors and your other implementing partners? That's, you know, even if we had the new tech coming in, it would, the length of time to actually introduce that tech would be until we've actually clearly communicated what we're doing. I've already mentioned the donor approvals here. It was both for adjusting their verification and kind of what is the threshold of comfort that the donor has, as well as piloting with a few new financial service providers who did have more contactless services that became more viable options as a result of there just being broader adoption now of contactless payments and digital payments that previously it wasn't the case. And obviously we're seeing that in many, many, many countries now. And the last was the information sharing, that even still as related to the process of registration, what are the targeting criteria, whatever it may be, our communication with our participants is very much grounded by, well, how do they want to receive information? I think the running theme for me is that the context guides the solutions. And this was just a really good example of the teams rapidly putting in the legwork to make sure that anything that they were thinking about, not only were they comfortable and confident with it, but that the communities themselves were also. The next example and last example I have from a rapid response programming that we have in Africa. Again, similar, this is not a sophisticated solution that they came up with, but they are working in an area with no connectivity, constantly deploying to different areas to do large-scale one-off transfers for 3,000 to 5,000 people at a time. And they are their solutions all need to be offline first. And their cash transfer elements, the notion of digitizing that is not really the priority right now, given where the context that they're working. And so they, again, using systems that they were already using, but then quickly could adapt, came to work with a pretty basic, I think, approach that many of you are likely familiar with, of scanning cards, but already having the databases linked to a certain unique ID. They had already gone through a lot of issues as related to data protection, taking photos or not. These were all things that the team had already been thinking about and just had to accelerate their implementation and piloting of it as a result of COVID. These two examples I placed because I think that the teams themselves were quite tempered in the way that they were introducing pretty basic adjustments. The adjustments were not basic in terms of the level of effort it took for them to actually do it, but in terms of tech, and if we look at these other, I think, solutions and products that were presented, these are not that, I think a lot of agencies would be able to do this on their own. But I think the lesson learned here is that the teams trusted the tech. The teams are the ones that were having to implement this. The teams are the ones that are facing the communities. And so, sometimes our trade-off is that we use something that maybe is less sophisticated, but we know works. And I think that's just a healthy tension that COVID has introduced even more so, where, what makes a good tech partner? Has that changed before and after COVID? What makes for good vendor management when we select a tech partner? I think all of these things, are still present, but there's still things that I guess as NGOs, I can at least speak for Mercy Corps, that sometimes we struggle with. And so what is kind of how much do you push versus how much do you trust kind of your experiences and maybe cautions that you've already felt before. And I think at least for me, it's been important to allow teams that space to think like that and not feel like they're being left behind or that they're not being innovative or that they should do this or they should do that. It's totally based off of what the program is trying to do, what the constraints of the donor are, and then that's it. So I'll leave it there, and thank you everybody for your time.
Thank you, Rosa, and thank you all the presenters for some great insight. Lots to take in. We've started with a quick overview from Jaki of the adaptations in mobile money, specifically as an area, and great examples from Ali of voice ID related adaptations. Moving on to Hans to talk about some super interesting innovation in growing the caseloads and kind of using alternative data sets for some of our enrollment challenges. And onwards for great examples from Simon of iris guard technology adaptations, and lastly to Rosa's great overview from Mercy Corps. My key takeaways at this point, if I may, kind of what speaks out is in all this, context is king. Choice for recipients is key, and there will be trade-offs as we are adapting, you know, whether it's in looking at fees, whether we're looking at increased load in terms of triangulating when we switch to remote, or whether it is increased risk around data protection. And helpfully, Rosa reminded us that preparation does matter. So some of the investments pre-COVID in terms of standardizing operating procedures and kind of being familiar with the technology so that you can have some basic adaptations also pay off ultimately. There's been some great engagement in the Q&A, and thank you to all the participants and the presenters for kind of asking and taking on questions, but we'll just turn to some of the unanswered ones to see if they can be addressed live. So we have one for Simon and Iris Guard from Joe. How would you anticipate this tech can be used when humanitarian agencies cannot meet people face-to-face to take the initial iris scan at registration phase? Simon, as predicted, tough questions. Over to you.
Good, and actually I did answer that to her privately as well, I think. Right. So, so I have addressed that one. But I think I'm going to answer this in another way, because it's a very big point about you know, field enrollment verification. The whole concept of this is that at some point in time, if an NGO specifically doesn't have their own ability to enroll, as I think I've tried to demonstrate, there are areas when an Irish Trust Authority, an authority that has already enrolled people for maybe for different reasons, can be used as an option for an NGO to utilize. And that's what we've been trying to hint at with our work on some of the additional cash out points as well. So collaboration is very important, but it's really key to know the strength of your, I think the strength of understanding of who you are actually enrolling into the scheme, and it's only, the systems is only as strong as the trust that you place in that person being added into the system. So there are several ways of doing this, and I also answered another question which was relating to post offices and the use of post offices, which actually occur in course in many countries as well, and can often be utilized as a safe quasi-government facility that could in fact be utilized to provide more than one service, to provide an enrollment, and then actually allow different NGOs, for instance, to utilize that system as well. And actually we've got some very interesting conversations with the Post Office Union about some of those factors as well. So I think that's how I'll answer it. Okay.
Thanks, Simon. Great one. Moving on to question for Hans. How does, I think it relates to the alternative use of data sets. How does an NGO wanting to use this method access phone data?
Yeah, so for us, we've gone through a long and quite sophisticated process, working directly with the mobile network operators as well as the local regulators. Incredibly important for the business, for the government, and for everybody to feel bought in, and to have multiple different MOUs and contracts signed. And so that was quite a long process that I think we had fortunately started working on pre-COVID already. And what we're currently doing is trying to implement these MOUs and these contracts across multiple different countries and contexts across the world. So not just in sub-Saharan Africa, but in Latin America and Asia as well. There have been recently quite a number of very exciting kind of master MOUs that several UN agencies have signed with key MNOs. So I see some exciting progress there. I don't think the industry is quite ready yet for every single actor to be able to plug into MNOs. I think there's a lot of concerns around kind of free roaming data access. I think we will all have to navigate it carefully and closely. But I think by the end of the year, we should have a few, at least get directly in a couple of these UN agencies, should have a couple of different models on data access for NGO actors, but also government and social protection programs.
Thanks, Hans. We'll certainly be waiting for the outcome of this research and awaiting the publication eagerly. I mean, as you were presenting, I have to say I was, part excited, part terrified with the potential of this, data getting into the wrong hands.
Anna, could I just make an additional comment to that, if I may, which I think covers all of it, is particularly in our example with Zain Cash, for instance, right? So which is a collaboration with the MNO. They have no data whatsoever. I answered this question again with somebody who came. They simply have a number and a value attached to that, which then links in with their existing wallet system. So I think it's a really important point to make, that the infrastructure and the ecosystem that the mobile network can give you, as long as, and I totally agree, as long as we are not sharing, large amounts of data that are very specific to the person, but the functionality, the security, I come from that industry as well, the systems that are in place mean they're actually a very, very good match and an adjunct to the facilities. But then you have to add on, okay, then I actually want to get cash out of the system, and that's where it transfers down the line as well. So I just wanted to add that to that point. Okay,
it's a great point. 100% agree. But then, with partners we work with CaLP, we also know some pretty dismal examples of what happens with that data downstream, and how it is actually used explicitly for exclusion. So that's the element that's the dystopian element potentially. Okay, we can perhaps now come to Rosa. There is a question around, speaking about exclusion risks, how Mercy Corps uses different approaches to minimize exclusion risks of most vulnerable when COVID-19 reduces ability to interact with communities. Rosa, over to you.
And again, I'll preface, I'm not our M&E experts, but I think it's just the notion that teams are having to likely triangulate more sources of data. There's inherently some data fragmentation as a result of needing to potentially rely on others for certain data sets. And if it helps picture the places that I'm referring to for Mercy Corps, where the challenges are, there isn't the sophistication of some of the MNO data or whatever else in some of the areas that doesn't make sense for us for excuse me, for a variety of reasons. And so, yeah, I think a lot of it, we have to rely on kind of doing double or triple triangulation as a result of that. I think, if anything, what I can stress is that these are not new problems for Mercy Corps, and I suspect many NGOs. In many parts of Syria, as an example, like we work through partners. We always have worked through partners, and so it's more so bringing some of the lessons learned from these countries that have deep experience with these types of non-visibility or whatever else. I apologize. To be able to just spread those lessons learned. But I'm happy, if you have my contact, I can get more specific about certain examples if that helps. Or at least connect you with colleagues who can do that. Yeah.
Yeah, that's it. And as you were saying, remote is not necessarily new for a lot of the INGOs, but it's the in the context of COVID, it's figuring out when socially distanced adaptations are enough and when you actually need remote, and then how to have that additional triangulation. Okay, I'm just very conscious of time, so I would encourage all presenters to take a look at the Q&A, see what you can address in typing. But I do have one last question for all of you. You've given everybody food for thought, but what would be your top tip for adaptations in the context of COVID-19 towards remote registration and verification? So your top tip, and I'm going to start with Ali, just because we haven't heard from you in a while. So thank you, Ali.
Yes, so can you just repeat the last part, please? Because I just missed
So what would be your top tip for adapting to remote registration and verification in the context of COVID-19?
Yes, so well, we've learned a lot during our bio project, and all the fears we had before was really answered quickly by the way beneficiaries adapted the usage of the new technology, and especially helping us do a lot of work in the remote area, especially during the verification process. So we were supposed to really try and give it a try, and then it was really good and successful response from the beneficiaries in using this technology.
Thanks, Ali. Anything from you, Jaki? What would be your top tip? What you've observed from your kind of bird's eye view?
I'd say for me, always prioritize the end user experience. Design for the people who you want to use the solution. If it's a long and tedious user process, then it will be long and tedious for the people you want to assist. And also really look into long-term sustainable kind of solutions, and not, instant solutions that will be bespoke, that will have no use beyond the current situation. That will be it from me.
Brilliant. Thank you. Start with the end user. Thanks, Jaki. Simon, coming to you next. What's your top tip?
I would say my top tip is to maximize the existing systems that you've got, and not be in a hurry to have a knee-jerk reaction to implementing technology just for the sake of implementing technology. So I think the situations that we have ongoing dictate that we should all exercise good practice. I think there's good practices that need to go ahead, and I think we have to be mindful of suddenly introducing something that is maybe completely different that might work, but you never know what issues that may introduce down the line. So it's important to handle crises. It's important. These are ongoing situations, but I think we always have to be mindful of good practices and systems that may already be there that we might be able to adapt to hook into. That would be my tip. Okay.
Brilliant. Beware of piloting in a crisis.
I didn't say piloting, yeah, but yes, you're absolutely right.
That's a good warning and a great point. Thank you. Coming to you, Hans, next. What's your top tip from Give Directly's experience?
So it's actually, I would say to think big, because I think the problem that's facing us, 18 million more people thrust into poverty, is a big problem.
Yep.
And I think we should be thinking about transformation, right? But I think along with that, along with thinking big, comes big responsibility and big caution, and big protection issues. And so that feeling of fear, Anna, that you've talked about, that both that simultaneous excitement and fear is something I think we wake up and feel every day, every morning. And so, you know, which is why I've tried to be careful in terms of both promising the potential, but also talking about the concerns. And so, you know, I think big transformation, but big responsibility. I think that's the message I want to leave with us.
Agree.
Thanks, Hans. I like it. Think big. It's gonna stick with us. Rosa, any thoughts from you? Your top tip.
Sorry, I was on mute. I mean, to piggyback off Jaki, I think designing for the user, but also recognizing that a layer of your users are NGO actors or UN, but I'm more familiar with the NGO side. Part of that decision-making process are the people who will actually be implementing on ground as well. That, of course, the priority is for the end-to-end user, but to make sure that within the capacity and your policies and your strategies, all of this, the tech decision-making can't be made in isolation. So yeah, just to incorporate that as well.
Yeah, another brilliant point. Okay, so our top tips from the presenters. We have a reminder from Jaki and Ali to start with the end user in mind, but also from Simon not to reinvent the wheel unnecessarily, especially when it comes to technology. From Hans, think big, because this is a big problem facing the humanity. And from Rosa, well, as we think about the end user, also bear in mind the responders, the first responders on the ground, and make sure the solutions work for them. If I may add one, and I know we're slightly over time, and there were a couple of key messages CaLP wanted to leave you with. If we can project that slide. I think some of this was covered by our presenters, but what I would add to it is in this unprecedented times, as we are adapting and inventing and kind of figuring out on the go, is not to lose sight of the need to build back better and try to avoid repeating the kind of bad design of the old normal as we adapt to the new normal. And one final announcement, just to whet the appetite for what's going to come next week from CaLP. If I can have the next slide, please. Yes, exciting times. We are just 8 days before the launch of the State of the World's Cash 2 report. please tune in. The registration link has just been posted in the chat box, and you can see the times on your screen. So it's 8 a.m. Panama, 3 p.m. Geneva, 4 p.m. Amman. Okay, we look forward to seeing you there. We thank all our presenters for their time and their great insight. I'm sure the presentation will be coming your way. And there's been rich exchange in the Q&A that CaLP will have Lynn and I will have a think how to turn it into a useful resource for the network. Lynn, over to you.
No, that's all. Thank you all very much and hope you have a good rest of the week. Please do continue to share in the D groups and through other CaLP channels. And thank you very much for sharing. Yeah. Have a good week.
Right. Thank you, Lynn and Anne and Rosa and everyone behind the scenes for setting this up as well. Good job. Thank you.
Thanks everyone. Bye for now.
Bye-bye.